it from there. Yeah.
What's happening to a woman, you know, when, especially for the first time when she gets pregnant, the hormones that take over, what are they doing to her, and how much does she understand, and how much should she read up about it, and what does the doctor need to tell her?
Okay, she'll be having a lot of physical changes, right? The details are extensive, but let me give you an example.
What about the emotional as well?
Oh, there are lots of those. But in the physical changes, there's just one little thing that when we tell a patient not to wear heels in pregnancy, everyone wonders why we do that, right?
Please explain the myth.
The progesterone, the hormone of pregnancy, is preparing the patient for delivery. It's loosening all the joints, the back, the ankles. It's not differentiating between the joints. It's loosening all the joints. All the joints.
And that started at the beginning of pregnancy.
Yes. So what is happening? Wear high heels, you may twist your foot. Normal circumstances, you're fine. But with the loosening of the joints, you tend to injure yourself more, right? The same will happen to your back. So if you need to wear a heel, hold on, walk carefully. Don't let yourself get injured, because the severity would be more.
I think that is such an important, you know, realization, light bulb moment for many people, because many times you're told things, you're not told the reason why, so you know, you really don't know what's going on. That's such a valuable
These
information.
Are little snippets. So coming to the emotional thing, a woman has all these surging hormones, right?
Poor husbands, they have to.
Poor husbands, they need to just back off.
Okay.
I tell the patients when the couple comes, I tell the husband, just think that your wife is right.
Right.
You're wrong.
That's it.
And that's it.
That's the rule of 9 months.
You want to get through this?
Okay.
just be there for her and let her tell you what to do, not to do, but do not argue, do not question, and if there's anything, ask me, but do not, you know, tell her.
Enter into direct confrontation. You have to be very tactful.
Very tactful. The worst thing you can say is, everyone's pregnant. Why are you having this problem? The worst but these are the things that happen. This is man is a social animal. You see other people around you, and everyone's pregnancy.
I think we needed a really important program for you, you know, addressing the husbands as well.
I think that should be separate.
We'll have a separate segment for their counselling.
Their counselling would start from the time they get married.
Right.
There's a lot that they need to do, and they need to understand.
Right.
And understanding that a woman is going through so many changes. She is, she's going to become a mother, but especially the first timer. She's got so much going on in her body, and she's confused. She needs to be just held close, cared for, nurtured.
Understood.
Yes.
Yeah.
And don't make that about, you know, everyone's giving birth, what's the big deal? For that woman, that child.
Oh, it's
and when we say,
very hard journey.
Yes. And when we say, remember we talked about the mother, the patient is a mother from the time she gets pregnant.
Yeah.
So just to touch on miscarriages.
Right.
The trauma of losing a child, even in the first trimester, is very severe on the mother.
That's true.
And the physical effects are also very severe. I tell the whole family, please don't think that because she's not bringing a baby home, that hasn't gone through a lot.
She hasn't gone through grief.
Not just grief, the physical changes. The grief is there because there's nothing to help her through those physical changes. She doesn't have a baby in her arms to carry her through those physical changes. But she actually has lost something. And thinking that this was just a couple of months, she was still a mother.
Of course, that's absolutely true.
For her, the emotional journey was still the same.